President Joe Biden said earlier this month that the pandemic is over.
Now, not all experts agree with that, but it could also signal a shift in how much money will be spent on COVID-19 moving forward.
KXAN's Grace Reeder takes an in-depth look at how that might trickle down to us here in Austin.
Business has been brisk, and that's been great.
As the worst of COVID-19 seems to be largely behind us, health leaders are talking about what it will mean to transition from a pandemic to an endemic. For local businesses like Waterloo Records, the shift away from restrictions has helped business.
We lifted our mask requirements.
So what is an endemic? The Texas Medical Association said there isn't necessarily a line in the sand, and no specific government or medical group is charged with making that call. But they described an endemic like this.
An endemic occurs when, in essence, the wildfire is transitioning into burning embers. They're still out there. There are still infections. There's still people getting sick, but you just simply don't have the sheer volume.
While that's good for businesses who are no longer plagued by restrictions, it also means government funding for vaccines and treatment could soon run out. Monoclonal antibody treatments, for example, could cost tens of thousands of dollars moving forward.
These are very costly medications, and was very appropriate for the government to pick up that tab. But eventually that coverage will run out.
While we might technically be nearing the end of the pandemic, that doesn't mean COVID-19 is going away for good. It's why TMA says people should get vaccinated now.
As soon as my staff could be vaccinated, they all got vaccinated, and they've all been boosted and reboosted.
Grace Reeder, KXAN News.
The Texas Medical Association said it's not yet clear when federal funding for COVID-19 vaccines or treatments will completely run out, but they recommend getting that recommended additional booster shot before that happens.
And currently, the World Health Organization lists the Omicron variant as the one of main concern. It has replaced all previous variants of concern circulating around the globe. There are 6 subvariants of Omicron the WHO is monitoring, but as cases still circulate, new variants could pop up. Now, looking at the state's current COVID infection data, the level of hospitalizations is at its lowest since June. Currently, more than 1,700 people with the virus are hospitalized, and that number has been dropping overall since the start of August.